Over the past week, there have also been concerns about the increasing number of COVID cases in India. Cases there are already reaching around 400,000 a day. But what needs to be done to prevent this kind of surge happening in the country? We now talk to infectious disease specialist and epidemiologist, Dr. Tayag. Good morning, doctor. Thank you for joining us.
Good morning, Ria, and welcome.
Good to have you, doctor. Now, what should the government do, and how can the public sector help to prevent a scenario such as what is happening in India from happening in the Philippines?
Well, we always take advantage of what we have done best. Like, for example, we have adequate number of testing facilities. The trick is for people who develop early symptoms, they have to access these laboratory facilities so that they can get the testing done. And what's important is that everyone who gets tested should begin their quarantine, and anyone who gets sick should be isolated. Another advantage is that our hospitals have established a good referral network, but for many weeks, and we are slowly coping with the situation wherein many patients remained on queue, and that this is something that we should learn, so that if there is further surge, we hope not, then the hospitals are ready. And our rich resource really are our frontliners. And we just hope that they don't get fatigued and that they remain dedicated, and that many frontliners from other areas that are not hired as yet will provide their services as well as to areas that have been considered as epicenters. Of course, it is a welcome news for Dole to actually hire more contact tracing, because that's also another trick. As soon as we find cases and make sure that we are able to identify the contacts, then that will be an advantage for us. But more importantly, Ria, when the vaccines do arrive, we hope that just many people will get vaccinated, because countries that have performed very well in terms of vaccination have actually shown to the world that cases can actually decrease and we can improve survival rates, including deaths.
Right. As we reported earlier, mass vaccinations may not happen until August. But the good news is Octa research says we might be able to expect a drop in cases over the next few weeks. That said, we also know we can't let our guard down. So, Dr. Tayag, are there other areas that need improvement in our COVID response?
For example, we have to examine the lessons we have learned from the community quarantine, that we actually make adjustments and which we have seen very good results, and look at ways how people behave right now, even with these controversial ivermectin issues and the waiting for vaccines, whether or not they should mask, unmask, whether there should be strict protocols for mass gatherings in indoors. This should be considered, and we advise people to prevent fake news from actually making wrong decisions, and that they should get their sources from veritable organizations like the WHO, the Centers for Disease Control, and the Department of Health, the IATF, so that they will be guided accordingly. Ria, it's very important, because social media has a lot of what we may call news that can be considered fake news, and this may affect decisions. And we hope that people are made aware. They should re-examine the evidence that's presented and be discerning. And of course, we have to also pray. Prayer counts a lot, Ria, because, as a Catholic country, the Philippines stands to gain more when we are actually working together, rather if we are divided, Ria.
That's right. We do appreciate your time this morning, Dr. Tayag. That was infectious disease expert and epidemiologist, Dr. Tayag.